An apple a day, brought to you by the health plan.
Patient-doctor communication may be one of the most important factors when choosing a primary care physician. Many studies have shown that when there's good doctor-patient communication, healthcare outcomes and health itself improves on patients. They understand their condition better, they can actively take a role in their problems, and actually speak with a physician and understand how best they can take care of their own problems. And when they have good communication between their physician and themselves, they can actually start taking a more active role in becoming their own solution to the problem. If you're looking for a new primary care physician, there are a lot of things you can consider. Reputation, so you can ask friends, family for their input. Maybe they have a primary care physician that they like. You can go on to some ratings on the websites, but you have to understand you got to take the good with the bad. A lot of times with rating websites, you're only going to hear the worst. The primary care physician needs to be available for you, so you want a physician that's going to have a good amount of office hours. I will tell you that overall, in general, physicians are scared of physician rating websites. It's just like with anything else. The people that have good experiences tend not to leave ratings on the websites, but if you have a very bad experience, then you just want to vent and you want to get it off your chest. So you'll go anywhere to leave a bad experience. So you just have to pay attention and weigh maybe one person's interaction. It may not have anything to do with the physician sometimes. It may be that they had a bad interaction with one of the office staff members that may not even work for that physician anymore. So instead of just looking at how many stars one patient listed for the physician, you really have to look into why that physician got a bad rating. A lot of physicians will allow you to schedule a consultation before you sign up for them to be your primary care physician. This way you can interact with a physician, get to know them, see if it's somebody that you're going to connect with and be able to communicate with. That may be an important factor in deciding on changing to a primary care physician as well. Patients' age can be a factor a lot of times when they choose a primary care physician. There's a tendency for younger patients to want to choose younger physicians. The thought is that they can grow older with their physicians and they won't have to change as frequently. I think a lot of times when older patients choose a physician, that may be less of a factor for them. So I think they don't look at the physician's age as much as maybe they look at experience, maybe they look at proximity because they're having more difficult times getting to the physician. You don't want to be so far away from your primary care physician that when you do need them, the distance is inhibitory for you to get to them. So that's important that they're close by and you can get to see them. If you're looking for a primary care physician, do your research, talk to your friends, and try to find a physician that's a good fit for you.
It's all a part of caring for yourself and your family. And that's what the health plan is all about.